My name is Miranda Ziva. I'm Project Officer for Zambian Youth Platform, where I'm managing the Enhancing Youth Action project with funding from HIVOS. This project builds capacity in adolescents and young people to hold service providers accountable for the provision of services and also for them to make informed decisions about their health. So amongst the best practices include the provision of services over the weekend through our weekend clinic initiatives, are mainly focusing on adolescents living with HIV who are supposed to access ART services during the week when they are supposed to be in class. So since they are unable to access these services, we provide them with services over the weekend within their communities. The other one could be the provision of referral slips, which we provide to adolescents through our community facilitators who go around in the communities, spreading the news of sexual reproductive health services available at the facilities and also in the schools where we hold awareness sessions on GBV, HIV, and sexual reproductive health. So once we provide these referral slips to them, they are able to access services with ease at facilities where we have also introduced signage to ensure that adolescents can easily navigate through the facility and access the services with ease and in privacy without having to ask around on what service, where they can access a certain service. We had an instance where an adolescent wanted to access HIV services at a facility where she found a healthcare provider who was not aware that the age of consent is 16 years and not 18 years as she believed. And so to address such challenges, we engaged Ministry of Health and provided them with innovative approaches through which we could disseminate these policies and guidelines to the health care providers. And we also held interface meetings at the facilities where we brought together the young people who are affected and the healthcare providers and also youths who work with the youth-friendly spaces.
So among the best practice, I think it's the way the project speaks to meaningful community involvement from the design perspective, identifying what is the challenge, designing what should the response or solution look like, because that in itself actually helps a lot, because we believe that community-driven interventions or solutions are much, much easier to implement by the communities themselves. They're much cheaper to implement, and more often than not, they're very sustainable because they can definitely outlive any external funding mechanism.
We engaged community facilitators from the facilities who were initially working at the facilities as volunteers, and by so doing, we ensured continuity of the project and such that activities are still running even after the end of the project through the community facilitators that we engaged. And also there has been continuity in linkage to services through our referral system.
So in terms of next steps, one thing for sure is that based on the findings through our community-led monitoring, we will develop an advocacy strategy specific to those key issues that have been picked up by young people, so we're able to build on that momentum, continue empowering these young people to push the advocacy agenda. I think to many people it might be unique, but it's an approach that we think that could go a long way if we continue pushing in that direction. This opportunity by HIVOS, the project itself, the opportunity itself was called capacity strengthening opportunity. And as an organization, as a young organization, we feel very privileged to have been part of that. And that definitely helped take us to the next level. We are not the exact same organization we were when we were beginning the partnership with HIVOS. I think we're now at the next level, and we're looking forward to getting to even the next level. So with support from such kind of partners that take the risk to invest in young people and hope to get a positive result, big up to them.